Addiction and Recovery Podcast. Understanding the terms that shape recovery.
Welcome to our podcast segment where we explore important topics related to addiction, recovery, and behavioral health. Today, we delve into a common practice that many people might overlook, drinking alcohol every evening for relaxation. Before we begin, I want to remind our listeners that this discussion is for educational and reference purposes only. It is not a substitute for medical, psychological, or professional advice. Many people have experienced moments when they feel the need to unwind after a long day. For some, this might include enjoying a drink in the evening. But what does it mean when this behavior becomes a regular pattern? Drinking alcohol every evening for relaxation is indeed a pattern of consumption. However, it's important to understand that this pattern may or may not indicate a problem. In fact, the idea that daily drinking automatically means someone is struggling with alcohol use is a common misunderstanding. While daily consumption is a factor to consider, it does not solely define whether someone has an alcohol use disorder. The okayness of this behavior isn't a simple yes or no. It varies greatly depending on individual circumstances and effects. For instance, using alcohol as a way to relax can become a routine for many, but it does not guarantee that it remains harmless. You might wonder how this plays out in everyday life. Regular evening alcohol consumption often establishes a routine. People may find themselves associating relaxation with alcohol, and over time, the body can adapt to consistent alcohol intake. This adaptation does not necessarily imply dependence, but rather, it reflects how behavioral patterns can develop and become established habits. These habits can vary in their impact on health and daily functioning. It's crucial to clarify what this does not mean. Just because someone drinks every evening does not mean they meet the criteria for a medical diagnosis. Clinical assessments involve specific criteria that go beyond daily use. Furthermore, the effects of alcohol can differ widely based on several factors, including the amount consumed, individual genetics, and overall health. The absence of immediate negative consequences does not predict future outcomes or long-term health effects. Understanding these nuances is vital for recovery communities and broader public health conversations. Recognizing that patterns of alcohol consumption can take many forms helps foster a compassionate and informed dialogue about behavioral health. For those considering a career in substance use disorder counseling or behavioral health, grasping concepts like this can be beneficial. It may help prepare you to support individuals through their unique journeys with alcohol and recovery. As we conclude, I encourage you to explore more about addiction counseling and behavioral health education. Institutions like InterCoast colleges offer resources and programs that delve into these important topics. If you're interested in learning more about education pathways in this field, you can visit intercoast.edu. Thank you for listening, and we hope you found this discussion insightful.
If you or someone you care about is struggling with mental health or substance use, help is available. You can contact the SAMHSA National Helpline at 1-800-662-HELP. Available 24 hours a day, 7 days a week, free and confidential, in both English and Spanish. You can also call or text 988 to reach the Suicide and Crisis Lifeline anytime. And if you're looking for treatment or support services near you, simply text your 5-digit zip code to 435748. That's HELP for you to receive local resources. Reaching out is often the first step toward recovery, and support is available whenever you're ready.